Good afternoon, everyone. Today, I will be discussing something regarding the Cushing syndrome. So, myself, Dr. Soumya Ranjan Mohanty, and I am an endocrinologist. So, starts with the history. In the screen, I think you can see the screen. Here is the gentleman. His name is Harvey Cushing. Initially, he was the person who described a 23-year-old female with obesity, hirsutism, and amenorrhea in 1912. And he himself, in 1932, postulated that this polyglandular syndrome was due to primary pituitary abnormality. So Cushing syndrome basically means a constellation of clinical features due to chronic glucocorticoid excess. So this slide is showing the various manifestation of excess glucocorticoid starting from the brain. In the brain, it can cause the depression and psychosis. In the hypothalamo-pituitary axis, it will inhibit the GnRH production from the this hypothalamus that will ultimately cause the decrease in LH and FSH, and it will also decrease the TRH release from the hypothalamus that will cause the decrease in TSH ultimately from the thyrotropes of the anterior pituitary cells, and also it will directly inhibit the somatotropes in the anterior pituitary that will cause the decrease in growth hormone secretion. And in eyes, it can cause glaucoma and also the cataract are commonly seen. The posterior subcapsular cataract is very common in the use of steroid. And then coming into the GI system, it can cause the peptic ulcers. And the metabolic effects are due to the insulin resistance, these are like hepatic glycogen deposition, increase in gluconeogenesis, and also there is lipolysis that will cause the...
After being trapped under heavy debris, the danger doesn't end after rescue. This is called Cushing Syndrome, a life-threatening emergency. When muscles stay compressed for hours, they begin to break down rapidly. Harmful toxins like potassium and myoglobin flood the bloodstream. This can trigger dangerous heart rhythm problems and may even cause sudden kidney failure. That's why IV fluids are started even before removing the pressure. Doctors closely monitor electrolytes, urine output, and heart activity. Quick diagnosis and emergency treatment can save the patient's life. Because in Cushing syndrome, every second matters.
Then is the cardiovascular features. Hypertension seen in up to 75% of the patients. Hypertension usually resolves with the Cushing syndrome, but at times it can persist because there is some microvessel remodeling is seen if there is a long-standing Cushing syndrome, and sometimes there is underlying essential hypertension that will cause persistence of hypertension after the Cushing syndrome treatment. And we have already these infections. We have now we know the infection, what is the mechanisms of infection, but there are certain infections that are very commonly seen, like reactivation of tuberculosis, fungal infections of skin like tinea versicolor and the nail, and the wound infections are also very common, especially the post-surgical wounds, and the poor wound healing also seen. Metabolic side effects, metabolic effects we have seen the increase in VLDL, LDL, triglyceride, decrease in SDL, and the insulin resistance that will cause frank diabetes in around 20% of cases, and glucose intolerance will be seen around 50% of patients. The hypothalamic metabolic alkalosis is seen especially in the ectopic ACTH syndrome. The mechanism is like, again, whenever there is a high cortisol, and there will be saturation in the eyes, glaucoma, and cataract we have discussed. Exophthalmos is also seen in around 1/3 of the patients due to increased retroorbital fat deposition. Ectopic ACTH syndrome, it is around 15% of Cushing syndrome is due to ectopic ACTH, and most common cause is the bronchial carcinoid.
Your heart gives warning signs before serious disease begins. Chest pain or tightness should never be ignored. Shortness of breath can indicate cardiovascular problems. Swelling in the legs may point toward poor heart function. Frequent dizziness or fainting may signal reduced blood flow. An irregular heartbeat can be a sign of arrhythmia. Extreme tiredness may be linked to cardiovascular disease. High blood pressure silently damages the heart and vessels. Early detection can help prevent life-threatening complications. Understand cardiovascular features. Protect your heart before it's too late.